Welcome, everyone. I really appreciate everyone joining us here tonight. We are here for Fighting for Religious Freedom, Florida's Fight for Repro Rights. My name is Katie Ryder, and I am the National Program Director for Jews for a Secular Democracy. We are thrilled to have everybody here. Tonight's webinar is part of our Jewish Women and Religious Freedom in Florida project, which is grant funded by the Jewish Women's Foundation of the Jewish Federation of Palm Beach County. We thank them very much for helping us put this on. We also want to thank our co-sponsors, the Society for Humanistic Judaism, Congregation Beth Adam, NCJW Greater Miami, Jewish Community Relations Council, Broward County, RAC Florida, Florida Now, Temple Israel of Orlando, the Jewish Community Relations Council of Tucson and Southern Arizona, NCJW Michigan, the Congregation for Humanistic Judaism, and Red Wine and Blue Michigan. You can see, Florida, that you have support from all over. It is now my great pleasure to introduce tonight's moderator, Denise Lettau. Denise graduated with a BA in Political Science from Pacific Lutheran University and subsequently received a JD from Seattle University. After graduation, Denise worked at the Institute of International Law in Kiel, Germany, and later, after the fall of the Berlin Wall, she worked as a senior lecturer at Humboldt University in Berlin. Ms. Lettau practiced law before entering the banking industry. Recently, she launched DMSM LLC, which focuses on real estate investments with the long-term goal of assisting single mothers to obtain home ownership. Most of her spare time today is currently devoted as a lay leader with the Jewish Federation of Broward County, where she is a board member and has served numerous roles. She is the immediate past chair of the JCRC of Broward. In addition, among her other roles, Denise is a co-founder of the L.C. Hastings Black Jewish Alliance within the Broward Federation. Please join me in welcoming Denise Lettau. Denise, the floor is yours.
Thank you. Thank you so much, Katie. Good evening, everyone, and thank you so much for joining us for this evening for a very, very serious and current topic within Florida. I'm just going to start by saying there is actually a Chinese curse, which actually does not sound like one. And it is essentially, may you live in interesting times. And these most certainly have been very interesting times, mostly because whatever we have essentially taken for granted as progress has been or is essentially being stripped away before our very eyes and somehow causing a sense of disbelief. Tonight, we are going to go over the current state of affairs with regard to abortion rights in the state of Florida, essentially reopening our eyes, so to speak, as well as learning how we can again regain a right that we had become accustomed to. So we're just going to jump right in. Let's get started. So first, I'm really pleased to introduce Florida State House Representative Dr. Anna V. Eskamani. Yes, I have to say that she became a doctor as of today. So everyone should, clap in the chat. Anna is a bold fighter for Florida families and everyday people. Born and raised in Orlando, she is the daughter of working class Iranian immigrants who came to this country in search of the American dream. Anna went to public schools, the University of Central Florida, and is a nonprofit professional was currently seeking her PhD in public administration, which she obtained today. She ran for office as a first-time candidate in 2018, flipped a legislative seat, and is proud to serve as a state house representative for District 42, winning both of her re-election campaigns in a landslide. She just ended her term as chair of Orange County Legislative Delegation of the Orange County Legislative Delegation and serves as the current chair for the Florida Legislative Energy and Climate Caucus. Before running for office, Anna served as a senior director at Planned Parenthood of Southwest and Central Florida. With a track record of sacrifice, endless hard work, and ironclad values, Anna is known across the state and nation as a leader who is unbothered, unbossed, and committed to the people of Florida. So once again, welcome Dr. Anna V. Eskamani. Next, we have Lauren Brenzel. Lauren is the campaign director for Floridians Protecting Freedom. They have over a decade's worth of experience working in electoral and advocacy rights for abortion access, including serving as the campaign manager for the Florida Planned Parenthood PAC in 2022, the organizing director for Florida for All Win Justice in 2020, and the statewide director of organizing for the Florida Alliance of Planned Parenthood since 2018. Their goal is to mobilize community members to create lasting change that leads to collective reproductive freedom. And the third panelist this evening is Laura Rodriguez. Laura Lee Rodriguez is the president of Your Right Hand, WRITE, and works as an independent contractor offering services to nonprofits. She currently serves as the Florida State Policy Advocate for the National Council of Jewish Women, NCJW, chair of Pro-Truth Florida, an NCJW campaign to expose fake clinics, chair of the Courts Matter Florida Coalition, and is a past president and is on the current board of the Greater Miami section of NCJW. A graduate of Boston University, Laura has worked her entire adult life in the nonprofit world as both a volunteer and professional. For nearly 20 years, she has served at Lehrman Community Day School as a PTA president, board member, librarian, and a director of institutional advancement. She was a senior campaign director and director of the Jewish Volunteer Center at the Greater Miami Jewish Federation and served as the chair of JPRO, Jewish Professionals Organization. Laura also completed the Jewish Learning and Torah 2-year study program of the Florence Melton School of Jewish Learning of the Hebrew University. So there we go. Welcome all three panelists. I also would like to say that at the end of this program, we are going to hear from Michele Eiger, who is the state organizer for RAC Florida, the Florida-based affiliate of the Religious Action Center, the social justice arm of the Union of Reformed Judaism. She is going to take a minute to share what RAC Florida is doing and how you can help. But first, we're going to start, I believe, with Laura Rodriguez. We're going to start with you. As a Florida State policy advocate for the National Council of Jewish Women, NCJW, can you speak as to how Judaism views abortion and reproductive rights? And also, do you see an intersection between religious freedom and reproductive freedom?
Thank you, Denise, and welcome everyone. I'm so glad everyone is here tonight. It's great to see and be with all of you. I can tell you that Judaism is pretty clear on abortion and reproductive rights as a whole. I can add to that it's also pretty murky, because if you're Jewish, you'd understand that pretty clear and pretty murky kind of coexist in Judaism. But I would say that across the streams of Judaism, the final word is that the mother takes precedent over the unborn child. I'm going to share a couple of slides with you that show some Judaic texts where we get our laws from and how we decide how we're going to move forward in those situations. So the first one is a question of personhood. There's a well-known text in Exodus where a woman is harmed when two men fight and she has a miscarriage. But the husband is only allowed to seek financial damages from the responsible party. So it's not a situation of eye for an eye, life for a life. So the conventional interpretation of this is that there are no damages sought for the fetus because it has not yet achieved personhood. So it's not covered under law. There's other interpretations of the same thing, in cases of capital law, if men struggle and they hurt a pregnant woman, and if there shall be a tragedy, you shall give life for a life. Here, the tragedy is assumed to be the death of the mother. So in that case, a life for a life would apply, but it does not apply to the fetus. Another text says that if a woman is pregnant, the fetus is mere fluid until the 40th day, which means it's just a part of her body. It's like her thigh, her finger, whatever. It's not a separate entity until the 40th day. Other texts, and if you are Jewish or you're not, our texts are comprised of the Torah, the Talmud, the Mishnah, all kinds of interpretations of what these things say. Another interpretation says that another Jewish text says that if a woman is having trouble giving birth, they, which would mean the midwives probably, bring it forth, meaning the fetus, because her life comes before that of the life of the fetus. However, if the greater part of that child has come forth and has taken a breath, then it is a person. Again, this shows that the mother's life comes before that of the fetus. Another text goes to if a woman has an affair and is pregnant, and the legitimacy of the fetus is in question, etc. Leniency could be shown to her to end that pregnancy because it would cause her pain, cause her family pain, cause emotional pain. Again, it's her life, not just her physical life, but actually her environment and her community, her place in the community is more important than that unborn child. The next text is more current, 1978. Again, where we're talking about where the woman who is pregnant is facing issues in her life that, if she had that child, would prevent her from seeking joy and happiness in her life. So it's being even more liberal with deciding what is right for them. It's not just her physical health. It's also her spiritual, mental, and maybe her economic health, her life with her children who are already here, and her life in the community. And again, in the last one, and this was written by, this is a halakhic interpretation, which is more conservative, but again, they're saying that it may not necessarily have to be her physical life, but also her mental, internal, and her life with her family and her community. To your second question, Judaism is not the only religion which has doctrine, law, and scripture protecting the right to reproductive freedom. Our Constitution protects our right to the practice of religion, the religion of our choice. Passing laws that obstruct this is unconstitutional. In this case, lawmakers cited their religion as impetus for the law. And so one religion is being imposed upon all of us. So we're not protected from religion. So we're not only protecting our own religion, but we're not being protected from one religion.
Okay. Thank you, Laura. Lauren, as the campaign director of Floridians Protecting Freedom, please fill us in on what Floridians Protecting Freedom is, first of all. Secondly, what the Florida Amendment 4 is, and what specifically you, or I should say many of us, are fighting for. And would you agree that this is about more than Florida, that this is in fact a national wake-up call?
Definitely. I love the framing of many of us. I sit on this panel with two people who've been heavily involved in this process. Laura helped set up and run the hub infrastructure for phase 1 of our campaign. We collected 250,000 of our petitions from phase 1 via volunteers. And that was a lot of labor of love on Laura's part, making sure that all of the hubs received guidance on how to do that, a firm submission process. And then Anna has been a phenomenal partner in repro work in general, and has helped us to raise funding for this campaign, has helped us with messaging for this campaign, has helped connect us with folks. And I'm also just looking at the invite list on here. I know Michelle's going to talk later, but Michele at RAC has done a phenomenal job, and there's a few people more on here. Like, it really has just been an effort by all of Florida. There's folks like Pamela Birchford who are on this call who helped defend the language in front of the Supreme Court. Dennis Reese and Felice Shoelaner on here who have helped ensure support from the Sarasota community and statewide. So by and large, the Yes on 4 campaign is a coalition effort, and it's a coalition effort that moves with a singular purpose. Even if there's so many issues that we don't agree upon, there is one thing that we all know to be true, which is that Floridians deserve access to abortion without government interference. And so by virtue of a true belief in rectifying the harms that were caused by Florida's extreme abortion ban, all of us have been able to come together and fight towards this purpose. We got through phase 1 of this campaign with very little belief from national stakeholders that we could get this on the ballot here. And now I'm incredibly happy to say that we have support from all over the country of folks who want to see Yes on 4 succeed in November. We started this initiative because we knew after the overturn of Roe v. Wade that we were in really dangerous waters. So we saw the writing on the wall with the passage of a 15-week abortion ban and with the overturn of Roe v. Wade. And we knew that there is no way that a group of extremist legislators who, quite frankly, don't support women, were going to stop at a 15-week abortion ban. We knew that they were going to push it further, and they have done so. They passed a quote-unquote 6-week abortion ban, which many people don't realize is talking about 6 weeks from your last menstrual period. So you could not have even had intercourse yet, and you are considered 1 day pregnant if you were to conceive during that menstrual cycle. And we know that they're not going to stop at that, quite frankly. It's a 6-week ban now. The next step is a total ban. The step after that is banning birth control and IVF. This is an iterative cycle. So often, abortion is a litmus test for a range of other issues. If you look at states that have abortion bans in effect, they're the same states that have higher infant and maternal mortality rates. They're the same states that still have an expanded healthcare access. They're the same states that have economic disadvantages in place in their public education systems. These things are all interconnected. And so Yes on 4 presents a real opportunity for us on a single issue campaign to communicate that you have to listen to voters. Our campaign is unique because it doesn't rely on legislators. We have some great ones. They're in this chat tonight, but we also have some who do not prioritize the people. And we have an opportunity to take decisions about abortion care out of the hands of politicians and put it directly into the hands of the voters. So our aim is to pass this initiative in Florida at 60%. It is the highest threshold in existence for a repro ballot initiative this cycle or in previous cycles. It is also the initiative that has the largest patient impact. So we used to be the number 2 or number 3 provider of abortion in the nation, depending on what year you looked at the data from. We now have lost over half of those visits, and we can anticipate losing even more of those visits in the upcoming few years, because health centers won't be able to stay open if we don't stop this ban, because we will continue to see OB-GYNs leave the state. If you talk to any of the providers in the state, they have already had instances of their doctors leaving because they have trained for decades and decades to be able to offer specialized abortion care and are now being told that they can't do that. One of my former bosses at Planned Parenthood, who not only worked as the chief medical officer for an affiliate, but also was an OB-GYN at the Veterans Hospital in Tampa Bay, left the state because she can't provide abortions in state anymore. And she trained for years and years to offer specialized abortion care. We have providers who have left literally for New Zealand because they are not able to offer specialized pregnancy care here in the States, and they don't want to be criminalized for offering best care to their patients. So it's not just about abortion, though this is a single issue campaign. It's about what it means for maternal care in general. It should be a national wake-up call. When you talk to folks who are organizing on the electoral level nationally about what it would take to get durable federal protections back for abortion, we are looking at 30 years. So somebody who is registering to vote today as an 18-year-old young woman will be entering menopause before, in a best case scenario, she can anticipate seeing any kind of federal protection in the same lane as Roe. You need 38 states to be in a pro-repro posture to ratify our Constitution to get some kind of semblance of care back like Roe. So we can exist in a place where we bop back and forward based on who's in office on whether or not we have a national abortion ban or national repro protections. But the reality is that the right has been given back to the states in the court's context, and the states have been told to decide what your law is. So we in Florida don't even have the guarantee of, even if we got a trifecta of pro-reproductive healthcare elected officials in office, we would still have to rely on our state to implement that policy accurately. And we've seen with policies as I want to say non-controversial, because this should be uncontroversial, but we still don't have Medicaid enacted in Florida after the passage of the ACA over a decade ago, because our legislature said we don't have to do that. The court said we don't have to do that, so we're not going to do that. And so the only way that we get access to care here in Florida, in a best case scenario, 30 years away from a federal protection, is by passing Yes on 4 this fall. This is the moment, and this is the opportunity that we have. So we're running a hard campaign, we're running a huge campaign, and we're running an aggressive campaign because we don't have the opportunity not to. Because if we can't win in November, people will not have access to abortion here for a generation to come.
Lauren, also, just in case there's someone on here not familiar with Amendment 4, can you give some specifics of the wording that you're asking actually people to vote yes on?
Yeah, so it says that no law shall prohibit, penalize, or delay access to an abortion before viability or is determined by a healthcare provider in the case of a woman's health, or patient's health, it says. It also carves out parental notification. That is very specific to Florida law. So for our Florida voters, that's because you have to have what's called a single subject requirement for any ballot initiative. In 2006, Florida voters codified parental notification for abortion into our state's constitution. So what we are outlining in our initiative is that it's meant to stop gestational abortion bans and things like the 24-hour waiting period.
Okay, great. Thank you so much. And now I'm going to turn to Representative Dr. Eskamani. You've always been such a strong proponent of reproductive rights in Florida. Can you provide us with an overview of the current legislative landscape in Florida regarding reproductive rights and how Amendment 4 fits into the landscape? What do you see happening if this amendment passes or does not pass?
Oh, absolutely. And I so appreciate the opportunity to share space. And as Lauren Brenzel highlighted, we are among just so many leaders in the Florida reproductive freedom space. And so I don't want to be repetitive, but I want to CC everyone that Lauren gave a shout out to, and of course to Laura and your amazing work as well, especially in leading on some of these important topics of how faith is an integral part in support of reproductive rights. Because I will tell you that in the legislature, those of faith tend to co-opt this issue into the extremes and basically insinuate that all people of faith are anti-abortion, which we all know is not the case. And in fact, it's the complete opposite. Data tells us that Catholic women use birth control too, right? And people of all faiths access abortion based on a conversation that they're having with their loved ones, with their doctor, with themselves, and of course with their God, and not with politicians. And so I'm really humbled to share space with everyone here. And thank you also, Denise, for the shout out. I did just defend my PhD not even 2 hours ago. And so you were the first person to call me doctor in a public forum. So I'm getting used to it, but it's very kind. And thank you for that. And my entry into this work, like so many, really started as a patient. I grew up in Orlando as a daughter of working class immigrants. And my mom unfortunately passed away when I was 13 years old after a long fight with colon cancer. So please, everyone, get checked. Colon cancer is actually becoming too prevalent among younger people as well. And so that loss created an environment where I did not have a clear guidance when it came to issues impacting reproductive health. I did not have a place to go to talk about even things like menstruation or consent or dating, let alone pregnancy and STI prevention. And because I had abstinence only education in my public school at the time, I sought out questions and guidance, which led me to Planned Parenthood. And so I worked at Planned Parenthood for about 7 years, which is where I met incredible women like Felice and Lauren and so many others, all committed to this work in different ways. And of course, working in the lion's den of the state legislature. And I will tell y'all that I grew up in Florida and had no idea that a state legislature really even existed. I mean, I had an amazing government teacher, but even in that class, we focused on the federal system of government. My first exposure to the state capitol was as a student at the University of Central Florida, where I got to go to Tallahassee to advocate for different issues that impact young people. And that exposure really taught me the necessity to be involved at a local level and how disconnected state legislators often are from the needs of everyday people. And as a volunteer advocate at Planned Parenthood, we were fighting back against, back then, the issues were often known as TRAP laws. And folks might remember this if you've been involved for quite some time, but TRAP is an acronym for Targeted Regulation of Abortion Providers. So when we had Roe as that shield, the direction that anti-abortion extremists took was often making it much more difficult to provide the service. They couldn't always explicitly ban abortion. They try to find ways to make it more difficult to access by requiring abortion providers have admitting privileges or requiring that health centers be ambulatory surgical centers or ASCs. So they basically created administrative burdens to make abortion access more difficult, to intimidate doctors. And then, of course, with the fall of Roe, you just saw this ripple effect across the country, trigger laws going into effect, and state by state abortion bans. Florida was always very uniquely situated, and Laura mentioned this earlier. In the Southeast, as other states around us were passing these abortion bans, Florida was an outlier, and it wasn't because of our politics, though I do think the grassroots perspective is supportive. Unfortunately, due to gerrymandering and voter suppression, the legislative makeup does not reflect the politics of the people. And so our legislative officials wanted to ban abortion, but they were stopped by the state constitution, which back in the 80s put into place a language around privacy. And that in 1989, the state Supreme Court ruled that that right to privacy encompassed abortion. So for several decades, despite efforts to go before the Supreme Court of Florida to reinterpret that language, and even efforts to completely rewrite that language by amending the state constitution, all those efforts failed. But unfortunately, with the fall of Roe, and then Florida also having a DeSantis court, Governor DeSantis appointed the majority of our justices right now. We all know what happened back in May, where two seismic decisions were made. One, allowing Florida's 6-week ban to essentially go into effect 30 days later. And two, in a 4-5 decision, allowing this ballot initiative to proceed, despite all efforts by DeSantis and his colleagues to make that close to impossible. So that brings me to present day and to the heart of your question, Denise. The legislature is not stopping at 6 weeks. And in fact, this past legislative session, there was an attempt to pursue personhood. And if it wasn't for the IVF decision in Alabama, we would have seen that law pass. The IVF decision out of Alabama spooked conservatives who honestly are not shy about their agenda. I mean, we know what they want. They want to completely ban abortion, take away access to birth control. They want to target and erase the LGBTQ plus community. And this is all about control. is all about taking away our freedoms and creating a system where we cannot truly be ourselves or have self-determination. And with that fact known, I think they become their own worst enemy, because if you're going to pursue a total abortion ban, then IVF will be included. And ironically, some are not hiding from this at the national stage either. And we just saw the Southern Baptist Church make a declaration that they're oppositional to IVF. And that is the MO of my colleagues. So they got spooked because of the blowback from Alabama, but I have no doubt in my mind they're going to try again. And actually, the Supreme Court opinions, in those opinions, especially Justice Sasso, who is one of the newest justices, she basically outlines a proposal, if you will, to pursue personhood. And so the justices overwhelmingly are also trying to create a new standard themselves, which is very, very alarming. And it further amplifies just the importance of Amendment 4. So you asked the question of, what happens when we win Amendment 4? And I always love to manifest that win, because that's what we want. That's what we're fighting for. That's what we're raising funds for. And that's why we're all here, right? And 60%, I know it sounds hard, but I want folks to find some comfort in the fact that we have done it before on other progressive and important issues. In particular, Floridians passed rights restoration in 2018. Floridians passed a $15 minimum wage in 2020. We have been successful in creating conservation fund dollars. So we have success stories with these one-time elections getting to 60%. Of course, it requires resources, it requires talking to everyone, but it is possible, and we can see that vision. However, I want to be very candid. It's not like the fights, the legislative battles are over when this happens. I mean, the Yes on 4 team is preparing for legal battles even after victory, because we know the legislature is going to be kicking and screaming and trying to push back against this. Of course, I suspect that due to the extreme vote record of many of my colleagues, the legislature will look different going into next cycle, but it's not going to be a flip, if you will. There's still going to be a dynamic where those who are supportive of abortion access will unfortunately be the minority in the legislature. But I do think that the message we send directly to lawmakers by voting yes on 4 does set a tone of what will be permissible in the next legislative session. But I think when it comes to repealing the current policies that restrict and ban abortion in Florida, it will require legal battles. And so that's what we're preparing for. That's what we expect. And it requires just a continued persistence in this effort. Even after November, of course we should celebrate, but we can't slow down. We have to keep going. And the last point I'll make is, you asked the question of what if we don't win? And I don't want to manifest that, but I do want to acknowledge the role that Florida plays in the country for abortion care. This is not just about Floridians. This is about the entire Southeast. Millions of people reproductive age are counting on Florida right now. Not every state in the South even has a ballot initiative process. And for those that do, their path to a successful BI is a little bit longer than ours. For example, Mississippi has a ballot initiative process, but I think it's going to take time for a state like Mississippi to be able to have a campaign within striking distance. And so what happens in Florida is a ripple effect. Not only does it ensure and open up access to millions of people of reproductive age in the Southeast who are going to come to us for care, but it also is a glimmer of hope for the whole South to mimic us, to replicate us, and to demonstrate that we care about abortion in the South too. And this is not an issue that is partisan. It's not an issue that favors, one religious perspective over the other. In fact, I would argue that religious freedom is so intrinsically tied to reproductive freedom. Even the notion of this country's foundation of people coming to this nation because they experience religious persecution and seeking a land to be free, to express themselves, that is no different than making a decision to end your pregnancy, to make a decision that is free of judgment and one that is right for you. So I do see these movements as being deeply connected as well.
Okay. Thank you. Thank you so much. Lauren, then that that really leads to what are the key strategies that Floridians Protecting Freedom are currently employing to advocate for the passage of Amendment 4?
Yeah, so right now I am super excited to say that we have a busy volunteer program. As of April 1st, we have already had over 1,500 volunteer shifts. And that is outside of the rally we hosted in Orlando to launch this campaign, where I'm really excited to say we had about 1,500 people show up to that launch as well. So since that moment, we have been moving and we have been grooving. But we need everybody's hands on deck. So I'm going to drop a link into our chat for what's called Mobilize. Mobilize is the program that we use in order to have volunteers have a basic hub to learn about anything that's going on in our campaign. And if you check this out, it doesn't matter if you are a homebody, if you live in state, if you live out of state, there is something for you to get involved in. So as of the 1st of May, every Thursday, we now host a weekly phone bank. You can do that from anywhere in the nation. It's all via Zoom. You can do it from the comfort of your home. We also have a weekly reach training, which is a distributed program that you can use to contact folks within your own phone. You don't have to call strangers. You can text your friends and family and let them know to get involved in this campaign. And we also have canvases across the state as a day of action in remembrance of Roe v. Wade. This upcoming weekend, we are having statewide canvases. For some of them, we're partnering with Prides and Juneteenth events. For some of them, they're door-to-door canvases that we're launching. So if you are at all interested in starting your voter contact efforts, you can make calls. You can sign up to canvass with us, and we'll have more events. So you should definitely get involved with our Mobilize. If you want to be on our email list, you can sign up at our website, floridiansprotectingfreedom.com, and get volunteer updates. We have an option for you to pledge to vote, and you can share this pledge to vote with folks in your community. It is really important to say, Anna talked about not being able to take this for granted. Dr. Eskamani talked about not taking this for granted. This is a really hard fight. Like, there is nothing to say that this is a given. There's not been a single day that I could wake up on this campaign and say, okay, easy peasy, the job is done. We have to fight every day to make this happen. And so if this is something you care about, I think a great example, as an organizer for 10 years, I try really hard not to involve my friends or family unless it's like a need to do, not a want to do. And I pulled out the stops this weekend where I was like, it's really funny if you think you're not going to be volunteering every single weekend starting like now on this campaign. And when one would say, I don't door to door, and I said, well, you better get ready to make phone calls. And if they said, I don't want to make phone calls, well, you better get ready to postcard. Like, we have to give everything that we have to this campaign because the stakes are too high. Women are going to die in the Southeast because of a lack of access to safe and necessary healthcare. This isn't a campaign that is set forward because this is an ideology that's important. The stake is that this is necessary healthcare that is currently banned. And so it is the time for us to get involved with this campaign. It is the time for us to give whatever we can. And that doesn't mean money. That means you need to be talking to everyone in your life and making sure they know that they have to go vote on Amendment 4 this November. It means talking to strangers about this initiative. It means posting on social media. We have to be out loud advocates because the stakes are too high. We cannot afford to lose this. It means that for generation minimum, people will not have access to healthcare in the South, because Anna talked about, we're the only state that has the pathway right now for a constitutional protection on abortion. I see people say that they're interested in postcarding. I'm really excited to tell you that we actually have an organizer who focuses on postcarding. We have an organizer who focuses on canvassing. We have an organizer who focuses on phone banking. So if you are interested in any of that, please, 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 please fill out our pledge to vote and click that you want to volunteer for this campaign, and we can get you plugged into our system to volunteer. We love to sponsor postcarding groups, I will also say. So I'm going to drop my email for folks who are interested specifically in that right now, so that I can connect you with our distributed organizer who focuses on postcarding, because I am the child of a postman, and I'm very obsessed with that as a voter contact method for my postcarding weirdos. It is one of the most effective forms of voter contact to send people a piece of mail, which we believe it, but others might be skeptical. But I can get you a postcard list and I can get you the data on that too.
Thank you, Lauren. Laura, Lauren and Dr. Eskamani have both touched upon how important this fight is in terms of the Southeast. So can you give us the national perspective, how important it is really for Florida to actually get through and pass Amendment 4, and how this can be helpful to the rest of the nation?
Well, I think that the fight in Florida is reflective of a nationwide fight. It's being fought in every state, even in the blue states, because the blue states also have anti-abortion pregnancy centers and groups that are working against healthcare, et cetera. And you know, we need to fight against those things. And I personally think that the Yes on 4 campaign has been so effective, and the ballot initiative, as I've talked to other state policy advocates in other states and people in the Courts Matter network, et cetera, and when I tell them the hoops that we have to go through, how many signatures we had to get, how much we had to pay for them, how much money we had to raise to just like to build the campaign, and then the percentage of the electorate that we have to get to vote yes. In other states, I mean, their numbers are like peanuts. So, I mean, if we can do it here, where it's monumental and a freaking Everest, I think that you know, if other states where it could be an Everest for them, or maybe they don't even have the mountain to climb, as Dr. Eskamani pointed out, they didn't even have that opportunity to do a ballot initiative. You know, I think they can look to what this campaign has done and how they've organized it and put it together. And yeah, it has its little jumps and starts and whatever, like anything else, right? But I think it's amazing, and I think it's an amazing model to put forward to other states that are going to be joining us in this fight, because it is a fight.
Okay, there was a question in the chat, and I do kind of want to respect it, which is, what is happening with the effort to require having to add a cost estimate on the amendment to get it on the ballot?
Oh yeah, got this. Embarrassing to be, so y'all, Pamela Birchford is on here, who's helping us with the strategy around this. I always feel so embarrassed to be answering these questions in front of an attorney who is like deeply in it. So I'm gonna do my best. So every citizens referred initiative, it's required to have a financial impact statement. It tells a little bit how they feel about the citizens referred process, that the legislatively referred initiatives don't have it, only the citizens initiatives. The complication for the Yes on 4 campaign is that our financial impact statement is now updated. So it refers to the 15-week ban being held up in Supreme Court, and it refers to the passage of a 6-week ban and waiting for that ban's implementation or for the 15-week to be thrown out. Because to make matters even more confusing, I'm so sorry, I can't believe I have to reverse the clock to talk about this. Our 6-week abortion ban was hinging on a Supreme Court case involving our 15-week abortion ban. So as soon as they ruled that the 15-week ban was constitutional, it set forward the pathway for the 6-week ban to be in effect. So now when a voter looks at a mock-up of our ballot, they're like, oh my gosh, what is this saying? It's talking about starting a 6-week ban and a 15-week ban, and there's no way to even figure out what it's trying to say. So a team of attorneys have been giving a ton of time, effort, and energy to this campaign to work with the Financial Impact Estimating Conference in order to get that language updated. We had a day in court about 2 weeks ago now, where a judge confirmed that the statement was inaccurate, misleading, and ambiguous now that we had seen the legislative landscape change. There is a whole world of back and forth between the state and the Financial Impact Estimating Conference and the committee. So we are fingers crossed for a solution. We have to figure this out by ballot printing, which happens towards the end of August. We will let people know if we have concerns in the campaign, but we're hoping to move forward in a place where we see all parties respect voters having accurate information on the ballot.
And I just want to add to Lauren's point too, that as Lauren illuminated in her in the response, this is not unlike the legislature. The legislature has been making it much more difficult to do ballot initiatives in so many ways. And it's one reason why this initiative is so expensive. I think folks are often surprised to hear just how much money it has already cost this campaign to even get on the ballot. And of course, the resources needed to communicate to a state as large as Florida to get to 60%. And I do want to uplift, Leslie made a point about getting 60% requires, this also being a nonpartisan and honestly multi-partisan campaign, right? Engaging Republicans, Democrats, NPAs, Libertarians, everyone, right? But the legislature puts these really just unnecessary rules and regulations around citizen-led ballot initiatives to make it much more difficult. And one of their attempts, by the way, was to actually limit the amount of money you can donate to these initiatives, which was actually knocked out by the courts. It's kind of ironic because corporations could give as much as they want to candidates, right? But they wanted to limit specifically how much you can give to ballot initiatives that were citizen-led. And that was all designed to just make it impossible for these campaigns to raise the funds that are only needed because the legislature creates these restrictions. So they're always trying to find ways to suppress the citizen ballot initiative. And one last example, there was an effort to increase the threshold to 66%. And of course, we were able to stop that from passing the legislature, and the voters would still have to approve it. The irony is to increase the threshold to 66% would require 60% approval. So they wanted to put that before the voters to make these initiatives even more challenging. So just want to provide that context to echo, right? Like these barriers are not manufactured by us, and in other states, you don't see them. Like they're very unique to Florida politicians.
Thank you. Thank you so much. I would like to now actually welcome Michele Eiger, who is the state organizer for RAC Florida, the Florida-based affiliate of the Religious Action Center, the social justice arm of the Union of Reform Judaism. So in June of 2022, Michele joined the Religious Action Center as its first full-time state organizer. Since then, the leadership team and she have focused on a strategic plan to develop and grow diverse, robust, sustainable Jewish communities statewide to build a more just, fair, and compassionate Florida. She is here with us this evening, and she's going to talk quite a bit about their organizing efforts. So, Michele, please tell us exactly what RAC Florida has been doing with regard to fighting for the passage of Amendment 4. And also, please tell our audience specifically how they can help, no matter where it is that they are actually living in the country.
Yes, thank you very much, Denise. And I would be remiss if I did not say thank you for all of you being here and for our esteemed panel who we have been working alongside of you and doing this work in all the Floridians since February of last year. I will just share that RAC Florida is one of over 200 volunteer organizations here in the state of Florida that are supporting the Yes on 4 campaign, that we have been here since the beginning. We were the people that were collecting petitions. We were the people that made history in the first month of collecting and breaking the goal, surpassing the goal of collecting petitions. In that first month, there are over 200 volunteer organizations throughout the state of Florida, and we are just one of them. We have congregational and community teams across the state of Florida that are working with our partners and allies to really now at this juncture, pivot to focus on educating voters, building deeper and more robust communities. We are not an organization that thinks that we want to be in a silo. We want to be in partnership. Those 57 Jewish communities are now what we are looking to as 57 deep partnership and communities that are bringing about the changes that we need to see in our state. We want to make sure the most important thing that you did here, right? We need to reach 60%. In order to do that, we need every single person to show up and vote. So our focus is on mobilizing voters. What can you do? Lauren already shared a little bit, but I will tell you what we started RAC Florida before, a little bit to really start to get people pumped about this is we began with doing an outreach to vote by mail voters. Dr. Eskamani already talked about voter suppression happening here in the state of Florida. For those of you who do not know, a new law came into effect and changed how those people who want to access the ballot using vote by mail can do that. We have partnered with the Yes on 4 campaign to do monthly phone banks to vote by mail voters in counties that have not yet reached a 50% threshold of re-enrollment. This is a really great way, like we've said, that this is a nonpartisan issue. This is about restoring healthcare to the over 84,000 patients that we were serving and the people that will come after. We also are doing a great, somebody put in the chat about doing postcards. I will tell you that in this campaign, Florida voters will get postcards from every single organization, right? In partnership with the Yes on 4 campaign, the RAC national office in Washington, we created a postcard. You can actually go on our website. I'll drop that link in the chat. You can order postcards directly to Florida voters that ask them to vote Yes on 4. We are postcarding from now until October 1st. You can postcard with us. You can postcard with the campaign. You can postcard with the League of Women Voters. You can postcard. We don't care. We just want postcards flying through mailboxes and into people's homes from now until October. And then I think the other thing also that I want to let people know, as Lauren shared, there will be other opportunities, right, for people here in the state of Florida to join phone banks. I will drop those links to do postcarding. But the other big part is to talk to people. If you do not follow the Yes on 4 campaign on social media, they have a fabulous new digital director. Their information is all there. How do we get this information to people is by having conversations with our neighbors, right? One of the great things that we actually did a couple of weeks ago was we hosted a do's and don'ts on how to talk about reproductive freedom with the great Damian Filer. It was a fabulous webinar that really just talked about how do we talk about this subject in a conversation where we are talking about the people that are sitting in the middle, right? We don't want the person that we're going to engage in an argument. And we already know that we have so many people behind us, but those people that sit right there in the middle that need to understand the importance of this campaign and what it will change for history. Here in the state of Florida, and like people said, and like Laura said, across this United States. I will share that even before postcards were designed, the RAC national office and people from congregations and communities all across the United States were like, when can we order postcards? So people, regardless of where you live, you can make phone calls to Florida voters. You can knock doors. If you want to make a pilgrimage to Florida, we are also asking people to do that. We have a great partnership with Central Synagogue in New York City. They are committing to come and knock doors here in Florida. But basically, I think really I want to just uplift what the other speakers on the panel said. This is about the patients. This is not a partisan issue. This is about the over 84,000 patients that lost access to life-saving medical and reproductive health care. And we are making history here in Florida. And what I say to people is, you do not want to miss out on being a part of history. So,
Michele, did you have an opportunity to place in the chat a link for everyone if they want
I
to?
am going to do that right now.
Okay, and then I'm
So
going to
here's
ask,
the postcard.
and I'm going to ask each of the panelists to just give their last thoughts with regard to, again, how to get people engaged. And also, Michele, if you do have something with regard to the do's and don'ts of speaking with someone, if there's a link for that, who may have, because it's a difficult conversation. So that would be very helpful too. So, Laura, do you have some last words you would like to share before we're running out of time? So, and I'm respecting.
No, I would just echo kind of what I said before. It seems to me that what happens in Texas comes to Florida. It doesn't stay in Texas. And what happens in Florida can go somewhere else and can be something good. So let's hope for that.
Lauren?
I want to wake up on November 6th knowing that I gave everything in myself to make this happen. And I don't want anybody in this state to wake up with regrets. We have to leave everything on the ground, whatever the sports metaphor is, but really and truly, we have to give it our all. We don't have an option. The stakes are too high. This campaign is closer to North Ireland's campaign or Latin America's campaign than it is to a traditional US electoral campaign. It's a human rights campaign. And so I look forward to fighting with everybody here bravely and strongly and aggressively in the upcoming months, because we don't have another option. So thank you for giving space and making space for Yes on 4 to share today.
And I'll just add to that too. Thank you so much for having us, Denise, and for all the organizations who hosted us. It's such an honor to be here. So thank you for creating space and centering the conversation on Yes on 4 and the importance of protecting our reproductive freedoms in the Sunshine State. The only thing I will add is don't think that a contribution is too small. I know that folks are often very busy, right? And maybe you're like, oh, I don't really have I only have an hour to give, or I don't have a lot of money to give. And I really want to counter any of these feelings that you are small and emphasize that every hour you have to give is huge. Every dollar you have to give is monumental. And so please, please realize that you can play a role in this. We need you to play a role in this. And like Lauren said, none of us want to wake up that next day and think, oh, I could have done more, right? I want to crash that night because I gave it everything I had, and I invite you to join us in that effort.
Okay, so I want to thank all of you so much for being with us this evening. It has been extremely enlightening, I'm sure, for everyone. And I'm going to pass this on to Katie to close.
Denise, thank you so much. This was, and to all of you, this was absolutely such an informative and inspiring webinar. I'm just really inspired by all of you and everyone doing all the work in Florida. I want to thank Michele Eiger for sharing her ideas from RAC Florida, Florida State Representative, Dr. Anna Eskamani, Laura Rodriguez, and Lauren Brenzel for sharing their time and expertise with us. I want to thank all our co-sponsors, and I most especially want to thank the grant sponsors of this program, the Jewish Women's Foundation of the Jewish Federation of Palm Beach County. Without their support, this program and overall project could not have happened. I want to remind everybody that the host of this was Jews for a Secular Democracy. Someone asked a question, who are we? I put our website on there. We're a pluralistic initiative of the Society for Humanistic Judaism, fighting for the separation of church and state and all the issues, including reproductive rights that are interwoven with that. We want our Jewish Women and Religious Freedom in Florida project is excited to announce that we are going to be working on a Religious Freedom Shabbat initiative this September in Florida. Join us and our many partner organizations and dedicating a Shabbat program to the better understanding the challenges while also celebrating the American ideals of religious freedom. If you are in Florida, if you live in Florida and you want more information about how to host a religious freedom Shabbat in your congregation or your home, please contact me. My email is katie@jfasad.org. You'll get it from me when I send you the link to this video. Thank you again, everyone, and panelists. You were amazing. Denise, you can be the moderator from now on for all our webinars. You are outstanding. I really appreciate it. We appreciate all of you for coming, and have a wonderful night, everyone. Good night.
Good night.
Yes on 4.
Yes on 4.
Yes, on 4.